Hello, I'm Alex Hui. Most people will have at least one panic attack in their lifetime, and some people have recurrent panic attacks. Although it is not life-threatening, it can be a very uncomfortable experience. So in this video, I would like to share with you what are panic attacks, the triggers and causes, how to differentiate between a panic attack and a heart attack, what to do if you have one, and how to prevent them. Panic attacks are sudden, overwhelming, intense feelings of fear and anxiety when there is no real danger. It is important to stress the fact that in panic attacks, there are no real physical danger. So for example, if you're in a bank and if someone is robbing the bank with a rifle and you're very frightened, that is not a panic attack. Panic attacks have both physical and emotional symptoms, such as racing heartbeat, sweating, shaking, shortness of breath, chest pain, nausea, dizziness, feelings of intense fear, and a sense of danger. The attack has a sudden onset and usually peaks rapidly in 10 minutes or less, whereas the whole duration could be from a few seconds to a few hours, where mostly it is from 5 minutes to 20 minutes. And panic attacks are so discomforting, it can cause a person to feel as if they are dying. Most people just have 1 or 2 panic attacks in their lifetime, but some people can have recurrent attacks, and they have a constant fear and anxiety about having more panic attacks. And this condition is called a panic disorder, and it has a huge impact on their quality of life. So what could trigger a panic attack? There are a couple main triggers of panic attacks, and they are: number 1, situational induced. Phobias are a common trigger. For example, someone who has a social phobia might have a panic attack during a party full of people. Or some people who are claustrophobic, meaning that they sense fear in tight spaces, might have a panic attack in elevators or airplanes. Number 2, events in life. Major life-changing events could increase the risk of a panic attack. For example, some situations that could remind of traumatic events that happened in the past, such as violence experienced in childhood or war, could lead to a panic attack. Number 3, major stress. Having a longer period of high stress or people who are constantly worried all the time have a greater chance of getting a panic attack. Sometimes panic attacks can come unexpectedly without any triggers, and unfortunately this is very common. It can come without any warning and can strike anytime, even when you are asleep or relaxed. So the above are the triggers or risk factors of a panic attack, but what is the cause? Well, people who have panic attacks often first experience physical symptoms such as a racing heartbeat, shortness of breath, or sweating, etc. And this causes fear and worry. And the fear could cause negative emotions or thoughts to come out, such as, oh no, am I gonna die? Oh, everyone is watching me, I am so embarrassed. Or if it's not the first time, oh no, not again, don't happen now, please. These thoughts will make you nervous, and the more nervous you are, the more severe the symptoms. Then the more severe the symptoms, the more negative thoughts will come out, and it goes on a negative cycle. Remember, panic attacks are only an overreaction to a perceived threat that has no real physical danger. As you probably noticed, the symptoms of a panic attack are very similar to that of a heart attack. Heart attacks are a blockage in one or more of the blood vessels to the heart, which causes damage to the heart muscle. While the symptoms of the panic attacks and heart attacks are quite similar, panic attacks are not life-threatening, while a heart attack is life-threatening, so it is important that we know how to differentiate them. Both panic attacks and heart attacks have chest pain, shortness of breath, sweating, nausea, so it could be quite difficult to tell the difference. However, there are some differences. One of the main differences is that for heart attacks, the chest pain could also radiate to the arm, jaw, or shoulder blades, while for panic attacks, there is usually none of that. Also, panic attack symptoms usually peaks and start to decline after 5 to 10 minutes, while heart attack symptoms, such as chest pain, gets worse over time. A lot of times, especially in a stress situation, it might be hard to differentiate between a panic attack and a heart attack. So if not sure, just call emergency services and seek medical attention. It is always better to be safe than sorry. What if you have a panic attack? What should you do? Well, first of all, you have to recognize that this is a panic attack, but not a heart attack. If not sure, always call emergency services. So now you know that this is a panic attack, the first thing you need to do is acceptance. accept that this is a panic attack and understand that there is no real physical danger. And yes, it is very uncomfortable, but there is no real danger. Naturally, most people will try to force and calm themselves down and have thoughts such as, I have to calm down, I have to slow my breathing rate, I have to stop sweating. But I don't suggest that, because the more you force yourself to be calm, the less calm you will be. Because you are sending a signal to your brain and telling your brain that this is dangerous and I have to be calm. And the more you think about that, the more anxious you will be. And then it could even heighten the physical and emotional responses. So fear feeds on fear. So why don't acknowledge that this is just a panic attack? It is only a perceived threat with no real danger. And know that it is going to pass and it will be okay. And once you have that mindset, you can start to use some techniques to rebalance your body. The first technique is abdominal breathing. Have you ever watched a baby breathe? They don't use their chest, but they use their belly instead. And by doing abdominal breathing, you can regulate your breathing and calm your mind. Because this can stimulate the vagus nerve and activate the relaxation response of the nervous system. Basically, don't use your chest to breathe like this. Instead, the chest should be still, and when we breathe in, we push our belly out. And when we breathe out, the belly goes in. Of course, we should be relaxed and we shouldn't force our muscles to go in and out, but instead we use more of our intentions instead. And I've actually done a detailed video about the instructions on abdominal breathing, and I will put a link in the description below. Abdominal breathing does take practice, and it has multiple benefits that I believe everyone should practice it regularly. Besides breathing, we can also do some self-massage. So I will show you 2 pressure points that can help. The first one is called the Hall of Impression. It is located right in between your eyebrows, where the third eye is. So you can use your middle finger, put pressure, and then do circle rotations for a few minutes. And this can calm down your mind. After a couple minutes, you can turn and do the other side as well. The second pressure point is called the inner gate. It is located in the inner side of the arm, 3 fingers length away from the wrist line, between the 2 tendons. This pressure point is great especially to relieve the nauseous feeling. You can do circle rotations clockwise for a couple minutes and then anti-clockwise for a couple minutes. And while you press these 2 pressure points, you can do abdominal breathing at the same time. And after a panic attack is over, it is good to practice some self-care. Drink some water or tea, doing some light stretching, taking a relaxing bath, or listening to soothing music can all help to rebalance the body and mind. For those who have recurrent panic attacks, what should you do to prevent it from coming again? First of all, mindset. Again, understand that panic attack is only anxiety over anxiety and they cannot hurt you. Don't give it power over you. Learn to accept it, and then they will come lesser in frequency and less in intensity, and eventually they will stop coming. Secondly, do regular physical exercises like walking, running, yoga, tai chi, qigong. Also, practice abdominal breathing. Again, the detailed instructions are in the link down below. Next, avoid caffeine, alcohol, smoking, or recreational drugs. All of these can worsen or trigger a panic attack. From a Chinese medicine perspective, these substances create excess heat in the body, which can contribute to feelings of frustration. So instead of drinking alcohol or coffee, drink more water or herbal tea instead. 4. Get sufficient sleep. Sleep deprivation could worsen anxiety because the biochemical reaction which comes with lack of sleep could make you feel overstressed or nervous. And lastly, getting treatments. Treatments can help to decrease the frequency and intensity of the panic attacks, and it can help to prevent it from getting worse. For example, acupuncture can help to regulate the autonomic nervous system. I have had one patient who has panic attacks due to claustrophobia, and after a couple sessions of acupuncture, the patient was able to be in tight spaces such as elevators. And another good modality to treat panic attack is Chinese herbal medicine. So I hope this video can help you understand more about panic attacks, and the most important thing is to know that this is not life-threatening, and understand that this does not have to affect your whole life. It does not control you, and with the proper mindset and treatments, the severity of the attacks can go down, and even better, never come back again. Thank you for watching today. If you have any questions, leave in the comment section below. Stay healthy, and I will see you next time.